Let's talk today about the prevention and treatment of diabetic foot, one of the most serious complications of diabetes. From these black and white images, you can just imagine how troublesome they can be. Those who have diabetic foot and have gone through treatment always regret not paying attention to this issue sooner. But there is no medicine for regret in this world, and it's very difficult for them to go back in time. So, I hope all friends with diabetes, those with long-term high blood sugar, obesity, and anyone with a family history of diabetes, start taking blood sugar control seriously early on and listen carefully to what we have to discuss today. To understand the concept of diabetic foot, let's first take a look at anatomical images of the ankle and foot area. The first image shows the skeletal structure of the ankle and foot, which supports the limbs. The second image shows muscles, tendons, and ligaments, which are the power devices of the ankle. The yellow lines in the third image represent the major nerves in the ankle and foot. Their main function is to transmit electrical signals. The brain commands movements of the ankle and foot, such as walking or jumping, through these nerves. The skin of the ankle and foot, when stimulated by pressure changes in temperature, and when the proprioceptors in muscles and joints sense changes in space, position, and direction, also send signals to the brain via the nerves, prompting further responses. For example, we instinctively avoid sharp objects or excessively hot water, or make quick adjustments to our body posture to maintain balance when walking on uneven surfaces. The red lines in the fourth image represent the main arteries of the ankle and foot. They divide further into smaller blood vessels that provide fresh blood, oxygen, and various nutrients to the tissues of the ankle and foot, such as the aforementioned bones, muscles, tendons, ligaments, nerves, and the outermost layer of the skin. Should these pathways become mostly blocked or ruptured and completely severed, the blood supply to the ankle and foot would become insufficient or completely cut off. The entire foot would then quickly wither and die, much like rice seedlings without water in a field. The blue lines in the fifth image illustrate the main veins of the ankle and foot, which serve as channels for blood to return to the heart. If these pathways are blocked, blood can only enter but not leave, leading to excessive liquid pressure in the tissues of the ankle and foot, causing swelling and several other problems. The tissues displayed in these 5 images, along with the outer layer of skin, together comprise the human foot. Each part has its function, and problems in any type of tissue can lead to related diseases or symptoms. However, among all the tissues mentioned earlier, the blood vessels of the ankle and foot, especially the arteries, are fundamentally the most vital. The diabetic foot problems we're talking about today refer to infections, ulcers, or deep tissue damage in the feet of diabetic patients caused by neuropathy and vascular disease in the lower limbs. This sentence encompasses 2 levels of causation. At the first level, diabetes, or more precisely, long-term uncontrolled high blood sugar, is the main cause, along with chronic inflammation and associated issues such as abnormal blood lipids and high blood pressure, leading to neuropathy and vascular disease. The arteries in the lower legs of healthy individuals should be elastic, like rubber hoses. But many diabetic patients' blood vessels resemble rigid cement pipes with little to no elasticity and varying degrees of blockage. During amputations for diabetic foot patients, I've witnessed arteries filled with calcified material, virtually no blood flow. Then there are the arteries near the toes and the tiny blood vessels that penetrate deep into the muscles, bones, and skin, which are finer than a strand of hair. This means they're more fragile and easily damaged. High blood sugar levels can produce more advanced glycation end products, molecules of sugar combined with proteins and lipids that are resistant to degradation, and this process can damage the endothelial cells of tiny blood vessels, causing them to narrow. In this condition, numerous tiny thrombi continuously form, further aggravating the blockage of these tiny vessels. The foot's nerves also require nutrients and oxygen, supplied by specialized vas nervorum. With long-term high blood sugar, these also become narrow and blocked. When nerves don't receive enough nutritional support and oxygen, they suffer damage and functional impairment. Since we have nerves and blood vessels of various sizes throughout our body, from the internal organs to the limbs and the brain, even if you're not medically trained, you can imagine the extensive impact of diabetes. Isn't this reason enough to control your blood sugar? The second layer of causation we'll look at is this: when significant neuropathy and vascular disease have been present over a long period, many people experience numbness in their feet and a sensation of coldness. This means that when your foot is injured, you won't instinctively move away from the cause of harm. For instance, if your skin cracks and a small wound forms, or if you step on a small nail without realizing it, you won't check your feet until a severe infection has developed, indicated by oozing, foul-smelling wounds. Neuropathy doesn't only affect your sensory nerves, it also impacts your autonomic nerves. This leads to abnormal secretion from sweat and oil glands in the skin, making the skin drier and more prone to cracking, impairing its natural barrier function. Even more critically, tissues in the foot may suffer from inadequate blood supply, not receiving enough oxygen and nutrients. This makes it difficult for tissues to keep up with the body's normal metabolic demands, much less produce new cells. Therefore, some people develop spontaneous skin ischemia and necrosis, then ulceration, and these wounds are very slow to heal. Bones can also become necrotic and collapse, deforming the foot. Sometimes an entire toe or the foot itself can undergo ischemic necrosis, turning into something resembling a charred stick. In the event of bacterial or fungal infections without adequate blood flow to deliver healing materials and immune cells, it's hard for the body to fight off such infections on its own without prompt medical attention. Bacteria and fungi can multiply vastly, invading the marrow and blood vessels and spreading throughout the body. Oozing wounds are common, and life-threatening conditions are not rare. From this, you should understand that the infections, ulcers, and deep tissue damage resulting from neuropathy and vascular disease in diabetic patients constitute diabetic foot. Many may think that the problems I've discussed seem distant and unlikely to affect them. However, let me list some statistics from 2 years ago for reference. There are currently 140 million people with diabetes in China. The incidence of diabetic foot among diabetic patients over 50 years old in our country is as high as 8.1%. Worldwide, 9.1 to 20.10 million people suffer from diabetic foot ulcers each year, with a global prevalence of 6.3%. More than half of the non-traumatic amputations performed annually are due to diabetic foot, and over 1 million people worldwide undergo amputations each year as a result of diabetic foot ulcers. So, should you prevent diabetes? Should diabetics control their blood sugar? Should diabetic patients regularly consult with doctors to check their feet? It's up to you to decide. Next, I will introduce the treatment of diabetic foot based on the 2023 edition of the China Diabetic Foot Clinical Treatment Pathway. If you are in another country, you should refer to your national guidelines for diabetic foot or the 2023 guidelines from the International Working Group on the Diabetic Foot, IWGDF. A reminder, please do not diagnose and treat yourself based on guidelines and clinical pathways. If you have diabetes and experience redness, ulcers, or fever in the foot, or coldness, paleness, or even blackness in your toes, or if you cannot walk a few steps without experiencing pain, cramps, and weakness in the lower limb muscles, which only eases with rest, especially the first and second conditions, you must seek medical attention immediately. Triage stations and outpatient doctors will classify your condition to determine if you need hospitalization for diabetic foot. Departments like endocrinology, orthopedics, vascular surgery, and interventional departments usually collaborate to conduct detailed examinations and assess the condition before treatment. Hospital treatments for diabetic foot can be generally divided into 2 categories, medical and surgical. Medical treatment involves using medication to control blood glucose, improve microcirculation, manage pain, fight infection, nourish nerves, correct electrolyte and acid-base imbalances, and treat malnutrition. Diabetic foot patients are also at high risk for cardiovascular disease, so if there are abnormalities in blood lipids and blood pressure, those must be addressed as well, sometimes with the use of antiplatelet medications. Let's also discuss surgical treatment. Debridement surgery is required to remove dead skin, ligaments, and bones if there is tissue necrosis or severe infection has reached the bone marrow. Multiple debridements may be necessary. If there is severe arterial insufficiency in the foot and ankle, and angiography confirms it, vascular reconstruction surgery might be an option if the patient's condition permits, to save the limb. However, this surgery is only possible for large blood vessels. The tiny vessels in the foot and ankle cannot be reconstructed. Through a combination of treatments, if the infection is controlled and blood circulation improves, most wounds can gradually heal. If large wounds remain, soft tissue repair surgery can treat them. Smaller ulcers may heal with regular wound dressing changes that maintain a moist wound environment. If a limb suffers from severe ischemia or infection beyond salvage, amputation is the last resort. However, it's important to understand that diabetic foot is not a problem that can be permanently solved with one hospital stay or one surgery. This would at best be a stopgap measure. Given the mechanisms behind the development of diabetic foot mentioned earlier, it's only a matter of time before a patient with unimproved high blood sugar, blood vessel blockages, and neuropathy experiences new infections, ulcers, osteomyelitis, or ischemic necrosis in the foot. That's why I want to emphasize the importance of preventive measures. Blood sugar management is the most crucial step. Both type 1 and type 2 diabetics should, under the guidance of a doctor, use medication, control their diet, adjust their sleep, engage in moderate exercise, manage their weight, and take a series of steps to stabilize their blood sugar levels within or near the normal range. Secondly, if you also have high blood pressure, high cholesterol, hyperuricemia, elevated homocysteine, or insulin resistance, these issues need to be adequately addressed to stabilize these indicators within the normal range. You can review my previous videos for more information on these topics. If you smoke or drink excessively, quitting is highly recommended, as these habits can affect your blood vessels and increase the risk of diabetic foot. Thirdly, it's advised to wear light-colored socks, so any wounds on the feet can be detected early. Prefer breathable, loose-fitting shoes with a comfortable fit and round toes. Before putting on shoes, always check for any foreign objects to prevent scratches or bumps on your feet, and avoid walking barefoot in unsafe areas. Fourthly, take care of the cleanliness and warmth of your feet. Wash your feet with warm water, not exceeding 45 degrees Celsius, every night before bed. Also, check your feet for any skin breaks, blisters, athlete's foot, calluses, areas of lower skin temperature, or unusual sensations. Early hospital treatment is necessary if any abnormalities are detected. Fifthly, and most importantly, leave the professional work to the professionals. Diabetic patients should routinely undergo metabolic indicator and foot condition assessments. After your initial diabetes diagnosis, your doctor will combine your specific conditions, such as complications of diabetes, vascular and nerve changes in the foot and ankle, or any foot and ankle deformities, with many other factors to determine your follow-up interval, which is typically every 3 to 12 months. The content above gives a brief overview of the prevention and treatment of diabetic foot. Prevention is less costly, and treatment is expensive. It's best to develop good habits when you're young to avoid progressing toward high blood sugar and diabetes. Additionally, the protection of foot health for diabetics should not be underestimated. Paying attention to your diet, properly participating in physical activities, carefully selecting your footwear, and regularly inspecting and caring for your feet are all significant aspects in the prevention of diabetic foot. Regular foot exams and proper nail trimming are essential. Remember to cut your nails straight across to avoid ingrown toenails, which can lead to infections. It's worth mentioning that high-quality diabetic shoes and insoles are now covered by some medical insurance policies, and these can effectively help distribute pressure on the feet. Using special diabetic foot care creams can maintain skin softness and reduce the risks of skin damage. However, do consult a foot care specialist or your doctor before choosing products or treatments. We should also acknowledge that once a person develops diabetic foot, it can significantly impact their quality of life and increase the burden on their family and society. So, it's not just a personal health problem, but also a medical economics issue. The direct and indirect costs of diabetic foot injuries, treatments, and care are both high. Prevention is always better than the cure. Lastly, for friends and family of diabetics, please offer them more understanding and support to help them manage their condition early. For medical practitioners, improving medical technology, increasing awareness, and decelerating the pace at which diabetic foot progresses and leads to amputation should be our goals. To conclude, whether diabetic foot arises, deteriorates, and leads to serious consequences like amputation, or is effectively prevented, managed, and controlled from the onset, largely depends on whether we are aware of the risk, how much we understand the condition, and what preventive measures we take. The journey to healthy feet is a long-term commitment requiring perseverance and the responsible management of our health. Diabetic foot complications don't happen overnight, they accumulate gradually over time. Prevention starts by not letting it begin at all. I hope today's content has been helpful to everyone, especially those who are battling diabetes or have diabetic family members. Health knowledge not only enhances our quality of life but can also save lives at critical moments. Please share this video with more people to raise awareness and help prevent diabetic foot, and let us all advocate for and contribute to a health-conscious society.